Well, if you saw the news yesterday, the federal government the Minister Task Team, the Presidential Task Team, did announce some new restrictions about COVID, and that did get a lot of questions coming through from that one as to the rationale behind it. Well, let's just talk briefly about that. We've got Dr. Alera Roberts, who is a consultant public health physician, joining us today. Good morning, and thank you for joining us on the program today. Well,
good morning, and thank you for having me.
Yeah, when that announcement was made yesterday, there were several reactions and people checking through different things. But one of the quick, overriding questions or dominant questions was that, wait a minute, looking through the NCDC's COVID-19 releases, and you saw that the last one was just about 49 new cases, previously about 37 or there, but maybe about 12 additional cases. And then they wonder, well, is there a huge concern here? What could have informed this one? Because they say, look, compared to some other countries, it's a huge wave. But here, they just can't tend to relate with it. But perhaps medically, you can.
Well, yes, you're very correct. And it has been a cause for concern for us in the public health space for quite a few months, because we've been watching the rise in cases in India with what has been termed by all of us as fear and trepidation. There really is no big difference between India and Nigeria in terms of the people, in terms of the epidemiological profile, in terms of the development, in terms of our geographical location in the earth. So what informed or what caused that surge? And that surge is actually very frightening. And the only difference that we can see is that we've had a greater commitment to the public health interventions, probably because we recognized that our health system really could not cope with an overwhelming surge of cases at any time. That has been our primary concern. That has been what the federal and the state governments have been, working very hard to keep up. And the one thing that was causing concern again, you will notice, is that this was after India in about December, January, they almost practically declared themselves COVID-free. Then what happened? They lifted the mandate of mask wearing, they started their mass gatherings, they didn't roll out vaccines, despite the fact that they are probably the world's largest producer of vaccines. They didn't roll it out nationally. They had election rallies going on, they had huge religious festivals going on, and then boom, we saw these cases rising and rising and rising. A daily case rate of 400,000 new cases. It was incredible. So, it only serves a responsible administration will only look inwards quickly and say, hold on a minute, what do we need to keep doing to ensure we do not go that same way? People have to remember, India was the medical tourist capital of the world. If anybody had a health system that should have been able to cope, one would have imagined it to have been India. So, where will we be if we have an upsurge in cases? Where will we be? We've shut down emergency isolation centers around the state in Lagos. We really cannot afford to have even the slightest uptick in cases, particularly with what the other things we're dealing with in country.
No, but Dr. Roberts, there are those who, because it's important that the citizenry are on the same page with the health authorities on this one, because they have to work together to get the kind of results that we all need. But right now, there are those who are struggling to piece these together, because when they look at the efforts that are being made, different states, they tend to see some sort of inconsistency. To them, this appears to be out of the blues, because they say some of those health facilities, they seem to have shut down, drastically scaled down preparations or activities for COVID cases. They appear to have moved on. Enforcement of this social distancing and masks appear to have waned. And then comes this announcement when they thought, so how do they reconcile this announcement with the level of preparation or consistency in different states? Because this may be a challenge to enforce, or the awareness for it to hit people. It might be a challenge, don't you think?
It is a challenge to enforce. We've faced that challenge since the beginning of this emergency response. I mean, ever since March last year, when we started the first lockdowns and we had huge public pushback, and we started all kinds of risk communication strategies to get people to understand. The truth of the matter is that because it appeared that COVID was not going the way it went in the US, UK, Europe, and other countries, people became complacent about it. And the truth of the matter is, all that the NCDC and the PTF have come out and said is that they are not lifting the sanctions. We rolled back ever so slightly, allowing for intra and interstate travel and international travel with protocols. But you will find that we never lifted the mandate on mask wearing. We never lifted the mandate on large mass gatherings. And perhaps you could say that, well, authorities may have turned a blind eye somewhat to allow some kind of normalcy to return. But now what they are saying is that, hey, we really have to enforce these protocols again. Because if you read the statement, it says that, for instance, the curfew continues. It was never lifted. I know people were breaking it, but it was never really lifted, and that curfew continues to stop it. Because the biggest super spreaders are the social mass gatherings. The social mass gatherings are the places where people become completely complacent. The use of alcohol and things, just diminishes people's inhibitions. Masks come off. You're eating, you're drinking, you're speaking into each other's faces because the music is so loud. These are the natural, and this is what becomes the super spreader events, in truth. Even in the transport stations, people don't stay in a particular place for any length of time. But I think it's important that the public understands that, look, let us just maintain our less than 50 new cases a day and continue to try and bring it down to zero, and make sure we don't allow cases to come into the country recklessly. We have nothing else that we can do. This is all we can do. This is all we can do, and we just have to just do it.
The restrictions, the new announcement just made, doesn't particularly mention schools, where, of course, that there are always gatherings and all, and it will seem like schools are getting back to normalcy incrementally. Do you think this might have any impact on schools, the way schools are operated now, whether in the public or private? Add to that, gathering in buses. How will that enforcement that government announced be carried out?
Actually, it does mention schools. Schools are to continue what they've been doing, because we have noticed that since schools reopened, we didn't see an upsurge of cases. There were a few schools that had a few outbreaks of COVID, but those outbreaks were very easily managed because they're young people, I guess. We didn't see overwhelming symptoms or anything like that. And once the school remained within a bubble, the infection was very easily controlled. So schools are important. Schooling is absolutely essential for everybody. So schools will continue the way they are doing it. A lot of schools are doing, well, not a lot of schools, but a few of the schools that are doing blended learning. Certainly at the tertiary institutions, we're still doing a lot of blended learning. Hostels haven't been allowed to resume. Students haven't been allowed to come back into hostel. So the school issue, if we're talking about it as a source of infection, has remained controlled. So there's really no extra cause for concern there, so long as they continue to do what they've been doing to date. Now, the issue of mass transportation is a huge one, because the mass transporters will tell you that they would spend more money and not make any profit if they were to operate at 50% capacity. But certainly everybody can themselves, this is where it comes to us taking individual plus collective responsibility. If you don't need to go anywhere, then don't. The government has already said that, grade levels 12 and below should continue to work from home or stay at home and just do. So that minimizes a lot of the transportation. I know the transporters are going to have a hard time trying to, make funds and all that. But the truth of the matter is, if people die recklessly, they will still not make any money. And that's something that we have to. So that's enforcement in the mass transportation sector. is going to be needed, and at least
Well,
getting them to 50% occupancy and everybody wearing a mask, that should help
well,
to reduce transmission.
one more thing, but what about, are we also taking into cognizance the fact that people are getting vaccinated now? So how does that affect all of this attention and preparations and notices that were put in? It still appears as though we're not factoring that in fully, are we?
Well, darling, to be truthful, 3.92 million doses of the vaccine is 1.96 million Nigerians vaccinated. Hardly a drop in the ocean. So unless we can get more vaccinations into the country, I am seeing, and I think a lot of us can testify that we're seeing a lot more willingness to be vaccinated than we've seen previously. But then that's because as Nigerians, we're very used to an immunization schedule. We're used to doing it for our young ones, and we saw what it did for us for the polio. But where are we getting the vaccines from? I mean, we need to get a whole lot more vaccines in country. At least, if I did the math right the other day, I think we were trying to do it, at least another, 56 million doses need to come in country, or another 56 million Nigerians need to be fully vaccinated for us to say that we are on the road to preventing an upsurge of cases. That's not going to happen anytime soon, unfortunately, if India continues to post the numbers it's posting.
All right, then, Dr. Alera Roberts, consultant public health physician and senior lecturer, College of Medicine, University of Lagos. Thank you for your time this morning.
Thank you very much for having me.